A very good morning to all the participants. I, Ravi Gatti, Assistant Professor, Department of Electronics and Communication Engineering, Sri Venkateswara College of Engineering, Bengaluru, Karnataka. We welcome you all for the final day, session 13 of the 5 days AICT Training and Learning Academy sponsored online faculty development program on training and social connectedness and inspiration, organized by the Department of Electronics and Communication Engineering, Sri Venkateswara College of Engineering, Bengaluru, Karnataka. For the today's session for 13 and 14, we have a special resource person with us, Dr.Somashekar.A.R, MBBS, DCH, DNB, Fellow in Respiratory Diseases from Singapore, Special Training Respiratory Diseases at University of Illinois, Chicago, and Professor and Head of Pediatrics, Ramaya Medical College, Bengaluru. First of all, on behalf of management, principal, and from the head of the Department of Electronics and Communication Engineering, we welcome you, sir.
Thank you, sir. Thank you.
Now, I would like to request Professor Sridhar N.K., Assistant Professor, Department of Electronics and Communication Engineering, SPC, Bengaluru, to introduce the session speaker to the participant with a brief profile. Over to Sridhar, sir.
Yes, sir. Good morning, all. Respected dignitaries and distinguished guests and participants joined on this online platform for 5 days FDP program on training for social connectedness and inspiration. It is my indeed great pleasure in welcoming the personality like Dr. Somashekar sir to the today's FDP program. Dr. Somashekar sir currently serving as professor and HOD in the Department of Pediatrics at MS Ramaya Medical College and Research Center, Bengaluru. He has an 16 years of teaching experience, especially trained in the pulmonology from KKH Hospital, Singapore, and UNIV, Illinois, USA, Chicago. He is an active member of IAP, that is Indian Association of Pediatrics, since 1999, and served in the various capacities like Joint Secretary, Indian Association of Pediatrics, President for State Respiratory Chapter, Secretary for Adolescent Health Academy, Treasurer for IAP State Allergy Chapter, Secretary for Kannada Vaidya Sahitya Parishad, and Organizing Secretary for PDCon 2017. Sir has published more than 30 research papers in national and international peer-reviewed journals and delivered more than 80 lectures on various topics. Having been recognized his work and service rendered to the society, Sir has honored with the various prestigious awards. To name a few: Kia Lahari Gold Medal for Research in Respiratory Field, Sri Krishnadevaraya Award for Social Contribution, Sri Kempegowda Award from Mahanagara Palike, Srimati Narayanamma Datti Award, and Dr. Day Award from Gokula Education Foundation. Dr. Somashekar sir love for his mother tongue Kannada is immeasurable, much inspired from the great literary scholars and poets of Kannada literary world, especially the first Jnanapita awardee and great poet of Kannada, Sri Kuempu. He has authored several books for children and adolescents. His work include ಕಂದನಿಂದ ಕಿಶೋರವರೆಗೆ, ಹದಿಹರೆಯದವರಿಗೆ ಕಿವಿಮಾತುಗಳು, ಇಚ್ಛಾಶಕ್ತಿ ಕಾವ್ಯಗುಚ್ಛ, ಉತ್ತಮ ಆರೋಗ್ಯಕ್ಕೆ ಉತ್ತಮ ಆಹಾರ, ಅಸ್ತಮಾ ಬಗ್ಗೆ ಅರಿವು. These are the few books that he has been rendered in Kannada. In this materialistic life, where money commands the world, it's rare to find the gem like Dr. Somashekar sir, whose heart beats for the poor and needy. He is the founder secretary of Aniketana Charitable Society, a self-founded organization working for the betterment of rural children from the past 15 years. The foundation has adopted 3 villages and conducting the development activities. Dr. Somashekar sir is a doctor with a difference. It is said, cure rarely, Comfort mostly, console always. These words can draw parallel to his style of treating patients. Many at times, his words confidence, moral support, and his beautiful smile could cure the patients. With these words, I welcome you to the session, sir. Thank you so much for joining us and taking time to deliver talk out of your busy schedule. Kindly enlighten and enrich us with your insightful talk. Thank you, sir. Somashekar, sir. It's
Thank you,
it's
sir. And
great,
also,
it's great
thank
opportunity. Yes, sir. It's a great opportunity for all the participants to listen and interact with this great personality. I'm sure you all will be benefited from this from his rich experience and expertise in the field of medicine and society connectedness. Thank you, one and all. Thank you, Somashekar, sir. Over to you, sir.
At the outset, I bring warm greetings from our institution, Ramaya Medical College, and as well as I sincerely thank the organizing team of Sri Venkateshwara Engineering College, and with salutation to founder V. Muniappa sir, patron Shashidhar sir, chairman Suresh, and convener Dr. Shiv Shankar, faculty development convener, the coordinator Dr. Dilip, and my dear friend Shashidhar, all the faculties and students attending this program. And today it is not a didactic lecture or anything like it's a monogram. I just want to discuss few things what's happening with the current scenario, and mainly I want to ask you like if you have any doubts, please feel to ask me. If any time permits, I'll answer. Otherwise, I myself will call you back, and because this area what I'm focusing is mainly on whatever the current pandemic and related crisis, as well as we are undergoing a lot of because of the social norms we are not getting connected to the doctors or healthcare personnel. Let me try to help you. If anybody anything, if you think even it's silly, please feel free to ask me. So let me start with my topic. It's not defined to one particular connectedness or whatever we are undergoing, the physical storms or the mental storm. We'll just cover it. What's happening with that, and let us try to find the solution. Share profile. Just Sushan, what is the emerging consequence of this global pandemic and this my institution? This is not the new pandemic what we are facing, but it is the second re-emergence. What's going on? So we know past 1 year, it started in December 19th, 2019, and WHO declared in March as a pandemic, and it has affected every station of our life, from education to employment, food to transport, and finally it has we are also affected directly, health as well as religion. What WHO estimates is that 132 million people may fall into extreme poverty. We are already seeing what's happening with us. People have traveled 1,000 kilometers on road, and without food they are died, and they were unable to get primary health care services. It's all because of the direct and indirect effect of this pandemic. And also, what happens with the global workforce? More than 3.3 billion are at the threat of losing their livelihood directly or indirectly. What happened with us? It is the diagnosis was a big problem. Previously, we thought of so many, everybody has pitched in, both paramedical, medical, everybody, scientists, to know the diagnosis, to understand the disease, progression, markers, and treatment aspect. Right from our good old BCG vaccine was thought it's a preventive measure. Then we thought our own vaccine, what we give for MMR, we thought that will be useful. Like that, and we started with some anti-malarial treatment, so on and so forth. And finally, we have come to some conclusion, some medication, at least what has given us the final clue is that early diagnosis, early treatment was the early recognition was the mainstay of anything rather than any treatment aspect. Quarantine has made a big mess. What is that? It has affected our social norms and stigmas and big huge of racketing. Treatment already is mentioned. Confirmed cases we are treated. What about the suspected? Suspected we had a lot of problem, and other patients suffering from other elements suffered like anything. So that is the effect of this pandemic. And also we were not prepared for this system of medical system. We are not prepared for this pandemic. What happened? Huge burden on right from the beds to medication, right from oxygen to ventilator support. We had a lot of problem. Somehow the government and everybody has pitched in, and we are able to. But what happened in the bargain? We have lost so many lives in crores, and to mention, we have lost more than, as my knowledge goes, more than 600 doctors lost their life in this pandemic. So, and as I mentioned already, we are not, it is the pandemic over pandemic. We are trying to address one pandemic, but we have forgotten the other pandemic. Our own patients were neglected. We are unable to address our diabetes, hypertension, those who got renal problem, everything. This is the problem because of the sudden surge of patient. And finally, it is the technical support was a challenge, and it was able to address whatever. But by the time we are able to address, it has costed many. So this is the cascade between the supply and the demand. We know that there was a moment restriction, loss of income, concern about COVID transmission, because each time we thought whatever they touch, our knowledge was very poor. How it is transmitted, how it is carried, how it is proliferates. Nothing we were known. Of course we were knowing that it transmits with any focus or any formats. So we continued with our restrictions or the health education. It all led to indirect morbidity, and it was a huge burden on health facilities. And it was the demand and supply was a lot of discrimination. What happened with economy? We all know patients how they are suffering. We say they can't go to the primary healthcare also. They can't afford the medications. They can't afford the hospital. Even middle class or lower middle class suffered like anything. Poor cash and flow market has affected. And of course, what we say, whatever we claim that our GDP, everything, but there definitely we have seen there was slowing down of revenue growth. See what has happened when there is no coronavirus, and this is when the corona is effective during the pandemic, of the growth of the economy, definitely, which is evident from the economic times. Society is affected badly, especially from newborn to geriatric age. It's affected our socialization, our travel, sports, schooling, festival season, and it has all led to kind of stress on our population. Coming to the student sector, there was schooling, online classes, postponement of examination, and in adolescent age group, especially the working class as well adolescents, they affected with the social distancing. And of course, I have not comment much on these hotel, restaurants, and religious places. This is the recent publications. What there's 1.6 billion students are out of school. And climate is there was positive. What they say is climate. There was 30% investment in clean energy, depreciation in clean energy transition. But what we found out in this pandemic, there was a clean city. All the lakes were very clean. All the roads were clean, and the environment, water, the air pollutant, both outdoor, indoor there was an increase, but outdoor the pollutants were very less. We have seen so many new breeds of the birds, and even the rare animals were on the street. They are going nicely, and definitely the air pollutant related diseases were less. That was the positive aspect of this 2020 COVID-19. It has pushed the poverty of 135 million are into poverty by. It is going to increase by 2030. It's all lead to what's happening with the social problem, economical problem, and related to pandemic related social restrictions, all led to big stress. What is the stress? It's the mentally, physically we all know we are suffering from. One is the pandemic suspected cases, proved cases, mild, moderate, severe one. Moderate, severe in the hospital, lot of mortality, lot of morbidity, economic constraints, not getting beds, not by getting the adequate oxygen, not getting the ventilators. People have died. Apart from that, we're also seeing a lot of mental distress. In the survey, they say 28% are found to have post-traumatic stress disorder. What is this post-traumatic stress? It is not the trauma what you're talking. It is the trauma because of the disease itself. After the COVID is not a respiratory condition at all. It affects each and every organ of the body. That's why in Ramaya Medical College, even other institutions started post-COVID clinic. After the COVID experience, people are to be very careful, right from minimal forgetfulness or increasing their optical, the refraction. We've seen a lot of cardiac issues, renal issues, kidney issues, and strokes. Main problem was what we have seen is they had trouble in sleeping, indirectly leading to sleep disorder as well as lot of problems related to sleep and increasing the stress on the heart, lungs, and the pancreas. 61% of them they said that experience an extreme manner, easily reported varied behavior related disorder or the stress, anxiety, and other things. Few of them, one of the survey said 60% felt lockdown didn't affect, maybe that was the sector where they were inside. 82% of them had the common elements like vomiting, breathing trouble, nausea, and related to obesity because of their stay at home and other obesity related disorder like snoring and hypertension and increasing their sugar status. This is the survey in by July 2020, there was 53% was increase in the mental health. We have seen a lot of cases where we have seen lot this time. We've seen many celebrities, many actors, many college going students, or post-retired person, or because of the lockdown, because of the poverty, because of the financial crisis, they underwent a lot of stress, resulted in calamities, which we all know. That was very bad bad experience we had. Along with the pandemic, one more pandemic was this stress-related calamities like suicide and other things. That has affected body, mind, emotions, behavior. In the body, we have seen headache, frequent infection because of the immunity will be low during this time because of no physical activity, nutrition was not addressed, and first of all, COVID infection will cause a lot of immune-related disorder. Muscle twitches, fatigue, they are tired like anything, skin irritation, and breathlessness. Post-COVID or pre-COVID, there are a lot of breathlessness. In the mind, psychologically, their judgment-related issues, nightmares, the fear of death was more negativity among everybody, and they were prone for accidents and instead loss of sex drive, and once again abuse was increased and restlessness, and indirectly leading to all the physical and the mental status. Also led to lots of confidence, more fussy, irritability, depression, apathy, apprehension, everything has added. One is physical body is affected with a long-standing disease were flared up, and the disease of pandemic has affected the immunity, led to a lot of infection. Coming to the mind, they had nightmares, anxiety, behavioral, stress, abuse, loss of sexual drive, everything, and leading to severe depression and loss of confidence. What is this COVID stress disorder? Stress disorder is one is due to COVID itself, or during the pandemic because of the social factor, emotional factor, financial factor, or norms. They are undergoing anxiety, depression, post-traumatic stress disorder. It is been accredited mentioned in DCM, that is the WHO criteria and disease. This stress disorder may be because of the illness or because of the witness suffering from the family or kith and kin being died because of the pandemic. Because we are seeing, if you call somebody, they know that they'll tell our auntie has died, our uncle has died because of a pandemic, or they are still in admission, they are in ICU, they are on oxygen, not doing good, or a close friend being died. It's all affected, lead to stress disorder, especially family members being affected. And also it is a stigma. Once you get, you should, I think our society is not open it for those who the recovered also. They see them in a way that something has gone wrong, or they have been affected because of their problems or whatever it is. Still the social stigma is going on. Whenever patient is there, there is to hesitate to help them. Forget about, see, social norm we are not supposed to expose, that is there, but helping was also was not there. Even calling them or assuring them was not there, and the friendship was not maintained, or the family or neighborhoodness, nothing was maintained, and that was led to social isolation and leading to stress. Already mentioned about economical loss, parental separation. Even it was situation is so bad. Mother was just newborn baby was positive. Mother was isolated. Mother was positive. Newborn baby was. That was the situation. And coming to our healthcare workers, it is not the doctors, it is overall who works in the field of healthcare. They all underwent a lot of fear of exposure every day and night. We think every person comes in contact with us will be exposed, and already 60% of us are exposed to this pandemic. Once again, lead to they'll be isolated from the family, they'll be living separately in a rented house or a room, and of course, deprived of social connectedness or the facilities. Maybe we have seen one orthopedician died in Tamil Nadu, and the locality didn't allow him to burn in the same locality. That was the situation. He has worked for the society. He died, and our people are so ignorant. They didn't allow his burial in their locality. That was the social stigma associated with the stress. Apart from this, how we can overcome, how we can increase the protective factors. It is overall, it is a social support. The society should get involved. Main thing is the education. Education is very, very important during that time of health education, what I meant, and connectedness with the society. We should not be living separate from or isolate ourselves from the society. So many things we see, organization, we talk about so many international organization, NGOs, everything, or they'll be talking in the social platform about the social connectedness, but we are failing to connect our own family members or our own kith and kins. I know difficult to provide stability, but we can just think there is a possibility. When we think of ourselves, we can still help them, at least not financially, at least to provide them the grocery or give a small job for the employment, more than enough. For healthcare resources, you can give them the PPE, or the gloves. Those are working in the field. The corporate or the group people helping us, some masks, and maintain the hygiene ourselves. We can maintain ourselves. We'll be putting everything our garbage on earth, and we'll be asking them to clean. Why don't we have practice of good hygiene practices? Very important. More than enough, our traditional wellness programs are very important. And important EPE, it is the last resort in our society. See, everybody is very much happy in society. Whenever I go to the some market, I get confidence that no, there is no pandemic at all, because nobody will be wearing the mask. I only will be wearing. We get, but that's not correct. Maybe the sector moving in the market will be in the middle age or encouraged. They'll not be suffering, but they carry the disease and give to the elders at home. And don't hesitate to do the test and take the treatment. I'll tell you, best is not any treatment, is early recognition, early reporting. It makes all the difference rather than anything. What is the statistics related stress has shown? Stress because of the pandemic or the trauma related to the pandemic has increased to 26%. Depression has increased to 30%. Abuse has raised, alcohol, substance abuse. Maybe you have seen a lot of media covered so much on uh, substance abuse, but they didn't address on the adolescent children taking the abuse every day, and that has increased to 13%, and suicidal ideation 10%. This suicidal ideation, they would have addressed all these things issues or some support. What we have failed is we, because of the surge of patients, we were unable to put ourselves into our psychological issues. Society would have pitched in to help their own family members. There was some amount of discrimination or whatever communication, or there is mismanagement was there, that has led to this stress disorder, depression, abuse, and ideation has increased. These are the facts, and we are all experienced. We have seen on all the platforms. Coming to the ideal that adolescent or our engineering students are speaking to adolescent or medical student or anybody post PUC, there is little different than the elders. They undergo, because of their brain will be growing till 20 years, especially the frontal cortex will be growing, a lot of ideation or judgment problem will be there with that. So they'll take everything, either they may neglect or seriously. They undergo a lot of grief or get into violence and over use of our social media platform, internet, cyber crime, or cyber abuse and everything, or sexting, everything. That is the stress on adolescents. Indian studies have shown that psychiatric morbidity in adolescents have increased to 31%, sudden increase from 14% to 31%, means 1 in 3 is suffering from either behavioral disorder or depression, anxiety, or suicidal ideation, or familial issues, or scholastic backwardness. One or the other is psychological diseases. Especially range stress has increased to 45%. Mainly we worry about high number of depressive symptoms because that is the way it leads to suicide. Why should we focus on adolescent? Because that is the factor where we get connected. That is the way we can prevent. Because of the age, because of their whatever the response, stress response, heightened response, they just react to the society, react to the situation badly. Each time they'll be affected with psychological functioning. They have their own underlying, maybe environmental factor from the home or the peer or from the school, maybe underlying genetic factors which has flared up now. So that's why we should address this population. That's what I mentioned. Because of the ongoing brain development and increased sensitivity of steroids, corticosteroids, they are vulnerable to stress-related disorder. These are all the, just an example. Mainly the exam phobia. We have seen a lot of in this pandemic. I've seen 4 or 5 students, engineering, doctors, those are in medical. They came on. They want to come out of their education. They want to join some jobs, and also they have lost self-esteem, atmasteria, and indirectly lead to depression and peer pressure. That is from the child point of view. Otherwise also they'll be having their other issues, like mainly the economical influence of the family related stress. We should focus them, build their immunity, and manage their stressful situations in life. Very important. Important with the adolescent is good nutrition. Good nutrition is very, very important. What we see that they are focused towards the fast food or the artificial food, which is leading to their obesity and related disorder. Just We should have a practice of having a healthy food at home so that they'll avoid this kind of junk food. And important is their nutrition is very important in this pandemic, because to fight against the infection, we have seen a lot of literature that nutrition has made a big role. That's why we started supplementing them with vitamin C and zinc. I think you all know about that. So important is have a good food. No need of medication. Good food or whatever the recommended food are evidence based more than enough. Important thing is you can't go on the street. Of course, it is open up. At least at home, they can do yoga, skipping, flying up and down, spot jogging, and online fitness class easily and freely available. Important thing is watching negative news is very important. Now it has come down, it has deviated because of whatever the political platform. They should be away. Only the reliable website they should visit from Government of India, WHO, UNICEF. Otherwise, they should better not to watch health-related negative news from the any channels, because it has been glorified in the words throughout the whole night. If you see at 9, 10 o'clock, some channel there will be Marana Bradanga Barisida COVID-19. ಈಗಾಗಲೇ ಸಾವಿರಾರು ಜನರ ಸಾವು. ಅದರ ನಂತರ ಇದು ಸಮೋದಯ debated. I'm very happy about that. And what happens if you just watch Adolescent? If he sees that, oh, so many people are dying, what will happen to me? What will happen to my family? So that causes the negative thoughts in them, and it start multiplying as a other leading psychiatric disorder. As well as important thing is we should keep, because it will affect their physical activity, study time, and family. They doesn't interact. Everything will be interacted now through the either mobile or the television. So parents will speak to the child through the TV, and child will answer to the parents through TV. So TV is a common factor in between them. So devices are very important. Switch off the devices 1 hour before sleep, and during especially in the bedroom, don't carry any gadgets as per American Academy of Pediatric recommendation. I think parents should follow these instructions. Very important. Very, very important is sleep. 8 hours. Sleep is a very good medicine. Very good medicine. That's how all the organs are being protected. Their circulation will be not impaired. They'll get their whatever the functional capacity, physiological capacity, immunity, everything will be affected. What do I seen that whole night an adolescent child will be watching either one or the other at 3 o'clock. He'll sleep, he'll get up at 12 o'clock. What will happen? Whole night, all the organs will be suffering from lack of sleep, the circulation, functional impairment, and morning all the endocrine organ doesn't secrete whatever their proper secretion they are supposed to do, either growth hormone or the related from the heart or the lungs or from the pancreas, adrenals, all the organs, whatever they secrete the silent hormones, it will be affected. So good 8 hours of sleep is mandatory. Once again, religious practice. It is not what I'm talking about the religion, whatever the practice at home of the group prayer. Prayer is very important, but they should practice in group. At family, all of them should, because that increases the positive reinforcement, family bonding within, and they'll get confidence within them, and personal and interpersonal skills will improve. So prayer is very good. Yoga and meditation regularly for relaxation, very important. Important once again is deep breathing exercise for a few minutes with prolonged exhalation. Just hold the breath and exhale slowly. That is done. They have done very good research in humans that has showed a lot of results, very good results. Especially, it is not only the behavioral aspect or the stress-related questionnaire they did. They even did some inflammatory markers that has showed very much decrease in inflammatory markers when they did yoga or sectional breathing. One more added advantage of this deep abdominal breathing is one thing, they'll reduce the obesity, increases the lung capacity, indirectly reduces the asthma or chronic lung diseases. Please log into remansyoga.com or any other official website related to yoga. Please practice whatever the physical exercise do. they should do kind of yoga and meditation. Already I mentioned about media distancing. Coping with stress. One thing we talk whenever the life skills for adolescent is a problem solving or the creative thinking or cognitive functions we talk about. They should adjust with the positive side of difficult situation. We should teach them. It is not at the level when they come to the college or when they have a stress. We should tell them how to solve the situation. Problem solving is very important because uncontrolled problem can lead to a lot of distraction and other things. So please, we should teach them with whatever the case scenarios or whatever the subject, maybe medical engineering or maybe the device or electronic gadgets, whatever it is, how to solve that at the sectional way. Very important. There is a stress, you should feel awful, then we should teach them how to positively coping with strategy. Positive, it is not that once at a time we can handle the stress. You should be how to understand the situation and what is the solution he is planning and what are the ways to come out of the situation. What do they say, how to say yes when it is a possibility, how to say when it is a possibility, what is a better outcome, you should always think of it. And first of all, you should not, there should be no ego or any other barrier to ask for help or guidance. That is important. Majority of the problems are because they create a barrier between the teacher or the student and student from the peer or from the family. So problem solving should be taught them so that it will help him there how to solve it in the positive strategies. Always keep each other safe and connected in everything. What happens last 2 years back, that was the year being declared as uh, about for the year of depression. And happy, one of the celebrity came out in public, said she underwent depression, and she openly said talk to each other and overcome the problems. That was important. What was the slogan of WHO? Talk to each other. What happens, we create a barrier within ourselves. If you see majority family will not be wishing our own family kith and kin or the brother sister, but will be knowing the celebrity's birthday, and in social platform will be wishing their birthday. And I've seen what I'm telling, what I'm saying. I'm in adolescent counseling, and I asked the same child, like, you know, your brother birthday, who is your first cousin? They'll not be knowing, but they'll be knowing the celebrity. This is the way we are maintain a big distance. So it is important. We should have a connectedness. Keep connected with your grandparents, and you can visit them. Maintain the relationship with your grandparents or the neighbors or uncles. Make your social group in it so that without any unconditionally you should develop the relationship. The physical distancing being mentioned in the pandemic is not a social isolation. You can connect it with a media, with a phone, or writing a letter. Important. See, now there are so many platforms have come. Now storytelling platforms have come, or reading books have come. Kindle, or so many there on the old, what are the literature have been explored. But they don't make them to feel alone. When they're alone, they'll get into the media or abuse or whatever the this thing. They'll go to depression and lead to complication. Important is stay connectedness. Very, very important. What we should do, stay home, be safe, keep your distance, go on. That's okay. But what all we can do? Read a book, online chat, phone a friend, write a letter, talk to your friend, take deep breaths. Okay, deep breath. Tell them, give a command to yourself. That's what cognitive breathing exercise or so many muscle relaxation exercise. Command yourself your capacity that I can do. Progressive muscle relaxation is a very good. Just tight all your muscles at a time. Slowly start releasing from the toe, then the ankle, then the knee, then the thighs, then the abdomen, then the chest, then the neck muscles, all eyes. Slowly release. Start commanding. Just tight it, then slowly my toes are getting relaxed. I'm feeling warmth. It feels good. I'm getting the energy towards the ankle. The pain I experienced is gone. The energy is flowing towards the knee. So start appreciating each and every organ. Very important. That is progressive muscle relaxation. Finally, while doing muscle relaxation, you will end up in relaxing your mind. Of course, please avoid junks. Already mentioned of sleep, because sleep is not only to sleep, it is to the regenerative all your organ. Avoid caffeine or energy drinks which is being advertised. Identify your unique strength. I've seen so many youngsters have written very good stories this time, very good poems. They achieved so many things, or they started their instruments, or they have become their own patented articles, device. They have done everything. Meditation and yoga they started. I'll just tell about this meditation and yoga later. So once again, what is the way to coping with stress is talk with your family and friends. Maybe you have had some conflict, some related issues. Just ask for sorry more than enough. Or if they are not asked sorry, just forgive it. Just say, forget it. I'm okay. They will understand. Maintain your routine. Just because you don't relax yourself or don't get a break. Focus on physical activity. What are the physical? You can just create a small garden of yourself, or plant a tree or a plants. Keep water for the birds or some feeds. Acknowledge your feelings, your love, affection, peace, what you are undergoing. Share with your friends. Have a good, healthy lifestyle with a good diet, sleep. Say no to alcohol. Disconnect from social media that whatever it is affecting. I said cyber sexting, cyber crime, cyber abuse, bullying, everything we see. See, we are identify ourselves. Our digital wall should be there. Our children doesn't know they have to keep their digital wall properly. They'll be supporting one of the parties or one of the isms, and finally something goes wrong. They'll be affected. Nowadays, even if or the jobs, when they're checking EQ, they're checking their Facebook also. Children without their knowledge, they'll be commenting. Recently, one of the I know this what happened. One of the worker wrote on people were writing on the Gandhiji's philosophy and other things. Somebody has commented some political related issue. They commented Mahatma Gandhi. He also mentioned the same thing. He didn't know what happened. Finally, he lost his job in US. The same person came and told me about the same incidents. Then I told, he got a child to me and he told me to counsel the child. I told him, shall I counsel? No, I am going to give some good personalities example. Shall I tell about Gandhiji or Godse? Then he has accepted that the whenever we talk about good thing, it's Gandhiji we talk. See, it is the we don't know the political related issues. This child, this person has lost his job because he has commented on that. Neither is connected to anything. Just because he commented, why I'm giving this example very important. Our digital wall should be good. And when I explained him what you have done a wrong thing. Okay, when we take 2%, whom we will acknowledge? See, he just blindly followed it. He didn't know anything, but he lost this. What happened? So when we are checking EQ, we should know what we are following with. But we should teach the children how disconnected from media and how to best use the media is also important. And seek accurate information is very important when you're talking about coping with stress. Yoga, always maintain the safety warmth, hygiene, and the and prepare in house also. Have a good practice of social distancing, hand wash, and how to keep the indoor allergens or the indoor environment clean. Just a word on suicidality. What are the warning signs you should see? See, you're all warriors. It is not that healthcare provider we treat them when they come to hospital, but you'll be knowing your friends or your youngsters, your neighbor, what is be undergoing with the problem. You should know some warning signs. What is the warning sign? Your own friend, if we become isolated himself, or if resistance has come down, or if it's loss of appetite, or is increase with substance abuse, and if there is a previous attempts of suicide, or he's got physical or terminal illness, somebody is suffering, he's become anxious or agitated, he's undergoing acute grief, feeling isolated, hopelessness, worthlessness, and just informed of suicidal ideation, extreme behavior of anger, mood swing, change in substance abuse, and he's got some risk factors, undergoing, he's got previous psychiatric disorder. What you should do? You should not do anything. Immediately take him to psychiatrist. Please don't attempt any counseling session with them. Important. Please take the help of medical fraternity. Very, very important. While before that, while handling grief, acknowledging the feeling of loss, allow them to express, so that let them speak, let them talk about their emotions, let them talk about their need, and stay connected. Help them to support the person who can they support them, and extend your help in future also. Don't give any judgment. Allow the family to spend time if they want. How to help the people solve the problem is, once again, identify the problem, list all the possible solutions, and discuss slowly. Meantime, all this thing, handling grief, helping people, meantime, first you should keep searching the medical fraternity and take their help. While handling this situation, especially in breaking bad news, whatever the failures are, to be prepared, how to put it across, how to address, what are the stepwise approach, and just check whether it's genuine, honesty, and make a setting, take the help of everything, and slowly break the bad news, either death or a failure or whatever it is. But take the gains, control yourself, take the positive aspect of yourself, and ready to support them so that you can balance their nature. While handling their angry or distressed person in adolescent, keep a distance, keep cool, don't respond until you assess situation. Call for help. Especially it happens with the hostel and the peer pressures, influencing for the abuse in alcohol or whatever it is. Inform the child or adolescent how to overcome, how to say no. What are the way to give the assertive skills so that they can overcome the situation with a safe way, keeping the safety into importance in a non-violent manner. After addressing this depression, on the suicidal ideation, on the stress related, what's happening with quarantine? Quarantine also indirectly increases the, even though it is helpful to avoid the contagion, which is very important. During that time they may undergo that kind of stress and everything. Keep talking to them, give them the very good nutrition food, just keep a watch on them, keep calling them, and address their what are the physical and mental issues. But isolation is very important. Generation, once again, to avoid transmission when they have a disease. Quarantine is once they recover, they can important. Please, this is not the time to hug or a kiss or anything. Keep maintain the social distance, very important. We know, like it is not, disease has not gone out of the city or the country. Only the reported cases are coming down, but still virulence is same. So maintain your social norms, very important. And already mentioned, but now it is the quarantine has been shortened, and they are coping it so that on the previous what are the rigid this thing has been reduced, but it doesn't mean that we should be out of our whatever the social norms. But in quarantine we have seen related anxiety, depression, substance abuse have increased, and all the other activities are improved. Please take care, because your corona related morbidity will increase. Very important, COVID-19. it is not only the physical effect or the mental effect, even the immunity is affected badly. There'll be down dysregulation of cortisol receptor site and Th1, Th2 cells. They are the mainly for mediated immunity that will all be affected, and they are susceptible to all kind of infection, especially tuberculosis or other contagion diseases, H1N1, or underlying any dormant infection will get flared up. So that is the immunity will be very low post-COVID. So that is the time maintaining the social norms. We are not only allowing or addressing COVID-related transmission, but you'll be helping yourself so that you will not get chronic contagious diseases. Good food makes a big difference. Already I mentioned, and which include a lot of vitamins. And be careful when you're taking hygienic food when you're consuming non-vegetarian. Overall, about after mentioning about the COVID related, overall general being what we should do during that time. We should take care of the body, mind, emotion, ecosystem, harmony within being. What is body approach in COVID? It is not only the exercise, it is the social distancing, personal hygiene. I repeatedly mention about this personal hygiene because one touch of somebody, just touching the same hand to our eyes and noses, led to a lot of process. Very important. Take the medication, and if requires, see the breathlessness or your respiratory compromise, report to the doctor. Once you are suffered from COVID, have a good follow-up clinic and go for chest physiotherapy and breathing exercise. Don't push yourself to a lot of strenuous exercise. Once again, meditation. What is that meditation I'm talking? Just talk to your introspection. Speak to yourself. Concentrate on breath. Meditation is not so easy what we speak. It is that your concentration, ekagrate, that is very important. It is not only sitting in a posture makes the meditation. Enjoy your whatever your cooking, your household work, or your writing or reading a book. That itself is meditation. But keep yourself for 10 to 15 minutes or maximum half an hour, or extend yourself to concentrate something more than enough. Oh, that is a good practice. Mainly aware of our breath. For each time increase your breath awareness time, that is meditation. Definitely that increases whatever there have been lot of studies on meditation related, how it affects on the brain, cognitive function, stress, cardiac function, especially the pressures, cardiac activity, and the hormone regulation. Very good results are there. Please do meditation. Yoga, for your kind information, we have done yoga related research, and majority in adults there are a lot of research articles are there in yoga and how it is helpful in hypertension, diabetic, and other chronic elements. But we have done in pranayama, effect of pranayama and yoga in chronic asthmatics, and it has published in peer reviewed journal that has shown very good control over asthma. Use of inhalers or the medications have come down. So, and also their cognitive function and behavioral functions also improved. So yoga has got definitely a positive uh, effect on the chronic elements. What we have studied is an prana effect of yoga and pranayama, and yoga has given a very good result. Also, involvement or whatever the strength recognize and involve in that, and give a positive reinforcement to the mind. Already I mentioned about the yoga related. There are so many studies from Nimans and the Narendra. There are so many stress, especially the Vyasa has done a lot of study. Dr. Nagendra Nagaratna has done a lot of research and in focusing on chronic elements with a good results. There are so many tele yoga right now because of the social norms. Tele yoga is also, please use the opportunities. Emotional balance is very important, and for that we should be the role model. We have parents should be very important when you are addressing the children's, and they should not be a wrong model expressing affecting the interpersonal skills or social reciprocity or abusing somebody. They should not become, and how to handle the emotions, very important. And it is not that a counselor or a psychiatrist will help. Emotions will be best handled by the parents, and that is not the time when they have become adolescent. Please, even if they have become adults, start a good practice of how to balance emotion, EQ. Very important for that. Meditation once again helps, and yoga. I got a positive effect on that. So all these supportive social factors are very important. When they are very well important, they should take the majority of the time. What I mentioned of the stress or the suicidal ideation, depression, whatever it is, they're all tip of iceberg. We will not be noticing that. So it is our duty to give some warning signals. You should address all those things. You should know what's happening with that. Identify that risk and give to the healthcare worker is important. Otherwise, if you miss the bus, you'll end up in calamities. So don't miss them. And important is make the detail and give proper information of symptoms or neighbor symptoms, and overcome their fears, and give a proper referrals whenever it is required, and inform the healthcare worker or the corporation and advise them to relax, and you also relax. Already I mentioned about social stigma being with COVID and COVID related illness. Let us not go to details. Let us stick onto the science. Science will tell what is social isolation rather than stigma. Let us not make stigma. I've seen in a lot of families, they're not given the room, they're not given the food within them, they neglected them, and that leads to once again they feel they are isolated. They have been neglected. It has happened with many of the families. Please, they are not purposefully got the disease. By incidentally, because of our neglect, society neglect, they got it, and it is our duty to help them. So, when you're talking about the disease, don't use the word like Chinese, social discrimination, or don't tell them they are suspect, and talk about infection, spread of infection, spread the rumors telling about others and negatives. Do is talk about the disease, tell a good aspect of how to overcome, who has overcome, how they have overcome, how does the health workers doing, how the hospitals are important. Tell them about social distancing, talk to the about people acquiring, contracting illness, and provide them financial help, emotional help, or social help, whatever it is. Avoid misconception and support the frontline workers. Very important, not hitting them. Digital platform should be very important. Already mentioned. It is not only the this thing. So many apps have come nowadays. Please use them. Checking their lung capacity, checking their heart rate or respiratory rate. Validated tools. Just use it and keep your health records. Check your respiratory rate or blood pressures, and even saturation can be checked. Very good tools are there. Please use that in this form. What is the guidelines has been given? Our Indian Academy of Pediatrics, Karnataka State Bench has given a guidelines about the COVID-19 how to manage. Of course, you all will be knowing. Just I'll reinforce on that. And transportation of student, avoid common bus transport. Testing of the driver is important. Spaced sitting. And institute keep giving the breaks important. Short classes are better, and at least for each make a batches important. Sanitize the room, and uh, what the guidelines says, if you sit in the same room for 15 minutes, it will be with a suspected person, it will be positive. Screen them and make sure short batches, and many subsection can be done, and shifted based classes can be done. Sometime offline classes can be done. Actually, I'm sure important you are raising. Important is face shield and the mask and the hand hygiene. Avoid work and be strict, because even we have seen our students, they'll be maintaining their social distance. When they're having food, they'll be together and they'll become positive. So important is avoid overcoming. Orientation towards the health is there should be, it's a mandatory of the institution as well as the class teacher as well teach students. Very important to orient themselves, because they should make responsible for whatever the for the health standard or the health safety, and be prepared if at all somebody is positive. What we are going to do, when you are going to refer him, what is the respiratory symptom or the related symptom, categorize yourself mild, moderate, severe. Have a simple triage form for your institution. Just check whether he's got cough, little cough. Sometimes what happens, children's they'll come and tell they'll be normal. Then you keep on asking, they'll tell, oh, I had little cough in the night. Just go a little further, little deep if yesterday I had fever. So that is over. That means they are infected whole class. So have a checklist and have a triage form. Every week triage form can be filled, and that makes a big difference. So and protection is once again, uh, avoid sharing the items. Tell them about what are the utensils, the food. Bathroom should not be shared, but it's available, but it should be sterilized. Classroom, wipe down the desk, skip the seats or the rows to create physical distance between the other student. Avoid placing your personal items. Dining halls, avoid sharing food, drink, utensils, and they can get the food and isolate themselves and sit. And in the hostel, laundry should be good. When you're throwing the mask or the gloves, it should be as per the guidelines, the infected material where they carry, and wash the mask as appropriately. How to change it, how to wear it, how to handle it is very important. Otherwise, they'll throw the infected into some dustbin, and our or the worker they'll grab it and they'll distribute to everybody. So and they also will get affected. Important thing is wearing mask, washing hands, watch your distance is important. Have a protocol, and just have a checklist about fever, cough, fatigue. If you want, I can send the triage form also, and know their severity. By knowing the simple questions, you can categorize yourselves whether they got mild, moderate, or severe. So, what are the student approach? When a question come, a student who has come positive, cough and cold, can he without fever? Can it be COVID? Definitely. It is not that only we should have fever. It's a simple cold and cough is categorized cold, suspected COVID. Be careful and ask them to get the test done. And 14 days of quarantine important. Why 14 days? Because that is the time anybody can get infected, and we report to this thing. They should stay at home. And it is not if they 14 days now the guidelines is RT-PCR test need not be done after the 14 days. If is fine, but if his test is positive, 14 days quarantine, he can come out. No need to repeat the test. As well as those are suspected, as well as those who are positive. Quarantine is presently for student. It is 14 days. So this is the flowchart already mentioned about this. If suspected patient comes, ask them to isolate themselves. If the symptoms are not come within 2-3 days, they can go the test. If it is positive, report to the corporation or the city, whatever the primary health care provider, and go for. If it is a mild, they'll give the oral medication. Moderate, they'll give you the warning signals or they ask for admissions. And we have got very good medications, and early reporting is very important. When this is suspect, if it is negative, even if you have got cough and cold, isolate yourself, take the treatment, and if it requires, they may ask for a repeat test or a quarantine for some time. Meantime, maintain your health, maintain your hygiene, maintain your good food, have a good sleep is more important, because any variation, this thing, it is a viral fever that gets triggered. What about much talked about vaccine? This is the biggest pandemic we have seen in our life, and biggest revolution is once again vaccine. Definitely, we are talking. Is it vaccines are coming? People are asking repeatedly. Yes, we are going to get nearby. Vaccine is there, and what's the question we ask? Is it safe? Definitely, it is safe. If like any vaccine, we have fever, cough, cold, and body ache will be there, maybe, but advantage is more than the disadvantage. Protection is almost 90%. It is prepared through government and public participation, and there's so many companies have come, but all are good. Take it immediately, and they may give freely or minimal charges. Take it, and first it is given to health workers, then to the chronic debilitated patient or immune related disease. All are eligible. There is no contraindications to this drug. 2 doses, and protection efficacy races after the second doses. Maybe they'll come and survey, take your what are the numbers, and please provide them, help them to serve you the better. That is very important. After mentioning vaccine, is that vaccine is going to help, but good vaccine. I tell you, it is your hand hygiene, your mask, social distance is the real vaccine than this vaccine. But avoid close contact, avoid hand checking, avoid contact with animals is very important. Thank you all. And just I covered few things on this situation, what's happening, and COVID related what's happening. What is that physical illness, right from undergoing physical respiratory problem or whatever it is, or post COVID, they'll have whatever the problems being addressed, cardiac and neuro and other things, and COVID related depression, anxiety, neurosis, either related to the COVID or related to quarantine or related to the social distancing or related to the financial crisis or related to loss of job or due to COVID itself, leading to all these things. Also, post-traumatic stress has increased, depression has increased to 30%, anxiety has increased, suicidal ideation to 10%. All these things, how to overcome? One is empathy towards them and avoiding their loneliness, social connectedness, and speaking to their early referrals and early recognition of the problems and how is their effect. Once again, some well-being, good practices at home, good physical activity, mental wellness with yoga and meditation, and in future, and how to be at the college level, how to when you enter. Now we have to get back to our norms, how to create ourselves within norms, how to save ourselves from this COVID, how to go with our life with a few tips. And I just mentioned about vaccine, about their safety and efficacy, and important of everything, more than anything, is a social vaccine of hand hygiene. Repeatedly I mentioned, but it makes a big difference and stay safe. Very important. And in this related, I just overall view, I just mentioned few things. But if you have any this thing, please chat box or use. I request Sridhar to communicate with me, write your mail or write your number, anything related to mental illness, how to address our cases, we'll try to help them. And once again, I thank the chairman and the faculty, Department of Electronics and Communication, and the university for giving me this opportunity. And any questions I'll take up. Thank you all.
Thank you, sir, for your informative and insightful session for the current situation. Actually, this was a right topic at the right situation, sir. In spite of your busy schedules, and you graced this event, and you have shared a lot of information. Surely, the participant will best make use of their in the day-to-day lives. Thank you, sir. Sir, some queries they have given, sir, participants. Shall I share, sir?
Yeah, please.
Yes. Good morning, sir. After recovering from the COVID-19, is there any chance of getting the infection again? What are the things to be taken care, like health checkups, etc.?
Very, very important question. I'm very happy who are addressed. And this is once you get infection, less likely that you are getting reinfection, but very high possibility it is not that you will not get reinfection. People have got a wrong notion to say that okay, I got infection, I am protected. No, it depends on your whatever the antibody you have produced. There is a test called post-COVID antibodies. There should be minimum of 1.5 should be there. I'll just telling a scenario. Maybe I may get 3, somebody will get 20. It depends on their immunity, their status, their morbid condition like diabetes or hypertension or whatever their age. So in that way, don't take chance. Even after the COVID also, be like you are going to get. Be alert yourself. Don't get this as a one of the plus point. Another thing what I'm telling, post COVID there are very high chances of for some people those are debilitated or chronic illness, there are being reported having cardiac related neurological illness or some related psychological issues are being noted. So report to the doctors within a month. Once within a month or 22 or 30 days, they'll do your inflammatory marker, they'll do your cardiac status, myocarditis or neurological function or lung-related breathing exercise. They'll come to know this limitation and they'll address the issues. All these problems can be addressed. Nothing to get cleared.
Thank you, sir. Thank you. There is one more question, sir. Sir, can a symptomatic person with zero symptoms of COVID but COVID positive spreads or infect any other person?
Definitely. some children, some are asymptomatic. They'll not have any symptom. Maybe they'll have cold. Maybe they are suspected because they are exposed to somebody. They are even though they are called as asymptomatic, but they can spread to others. So asymptomatic means that they are safe. They may infect others.
Okay. Thank you, sir. There is one more question, sir. How should parents take care of a 1 month old baby during this pandemic? Because child cannot drink nothing rather than mother's milk. Kindly share your views, sir, and guide.
One more important thing is here, once newborn baby cannot take anything. That's important. So what baby should take? Only breastfeeding. Breastfeeding has got all the immunoglobulin, interleukins, and interferons. All the positive aspect are there in the COVID, and it doesn't transmit from the breast milk. If mother is positive, it doesn't transmit through the breast milk. Only thing is she may transmit through the mouth or the breast. If she weigh the personal protective factors, and she can do the breastfeeding. Best thing in the COVID is breastfeeding. Breastfeeding has got all the immunoglobulins, and it helps the baby. She has to continue. It's a good thing.
Thank you, sir. There is one more question, sir. COVID-19 is second wave started. How to protect life?
Let us not think that first wave has gone. So before second wave, first wave itself is not gone. Maybe some because of the whatever the norms, the cases being checked has come down. We are not testing everybody, and asymptomatic cases are there, and the number of cases have come down. But let us not assume that the first wave has gone, not gone. And it is there. And when it is not there, it doesn't come up the second wave at all. We are not control the first wave only. Please, what I'm telling, don't think that the number of cases should not be some principle for us to move on freely. Government or health department has not given any social mention about their easy traveling, not wearing masks, or not hand hygiene. Everything should be like what we were preferred. They just opened few of the sector for our livelihood. That's what I want to say. Second wave can be started already. We have seen in Bihar and the Delhi. It is already started. So let us not think of first or second wave. Think that wave is there.
Sir. And what you advise for the senior citizens during these pandemic cases, because it's very long time, and still they have not yet come out because of these situations. So, what are the best possible suggestions you can give to them, sir?
Sir, one thing the government of India from the health department has not given any. This thing senior citizens should be, because they are the target vulnerable age for this pandemic. And once they get it, they go to get severe, moderate to severe levels. So when it is a thing is like this, when the clinical scenario is like that, they should avoid coming out of the social gatherings. I think we have seen a lot of them in the marriages. Thousands of people are joining, and majority the elderly people are there. And they have got a social fund, they should go and attend the marriage. The bride and bridegroom, they'll have the marriage like nothing. Why they should go? And nobody wears a mask. These people may be wearing, but other person will not be wearing the mask, and they'll become vulnerable. Please, I request all the elderly people not to move around. Wait for the vaccine, take the vaccine, then move around without all the social norms. And for them, what I'm telling, please continue your breathing exercise, your prayers, your meditation, good nutrition. And it is not that you should go and work. If you're on the balcony, you can walk, or on the terrace, you can walk, or the house only. If you keep on rotating every hour, you walk for 10-15 minutes is more than enough. So, in over a period of time, you will be finishing 5,000 to 6,000 steps.
Thank you, sir. There is one more question, sir. Now, children have less chance of being affected by COVID-19. Is it true, sir?
Not at all true. They are equally affected. Means the thing is, their severity is less. Their severity, symptom, and the mortality is less, but they are equally affected. And another thing is, they are also undergoing this post-COVID related issues called as the systemic inflammatory response, and related issues also going on. They'll have a lot of joint issues, cardiac issues, even the, but In our state it is less, but it is reported in other state they have something like inflammatory response.
Thank you, sir. Thank you, sir, for your very valuable and insightful information related on this COVID-19 and about the health issues, sir. And we got very positive feedback from the participants also, sir. Thank you, sir. The session, informative session, excellent session for today's preparedness, informative, nice session, very informative session, sir. Very informative session, sir. So these are the some of the feedbacks what the participant has been posted in the chat box.
Thank you, thanks for the opportunity.
We will resume at 12 o'clock, sir, for the second session. Yes. Dear participants, again, Dr. Somashekar sir will be continuing for the session 14 of this 5 days AICT sponsored, Atal sponsored FDP. So we request all the participants kindly join for the session 14 at 12 o'clock. Thank you, sir. Thank you.
Thank you, sir.